cardiac arrest is not the same thing as a heart attack. It's important to understand the difference. With cardiac arrest, the heart literally stops beating suddenly and completely, and death can occur within minutes. The question, of course, is why. Let's talk to 360 MD Sanjay Gupta. He's a neurosurgeon, also a certified medical examiner. Sanjay, we know the autopsy is going to begin tomorrow. How long does it take? What are they going to be looking for?
Well, if it's something really obvious, if there's some sort of structural problem with the heart, some sort of defect that maybe he had long-standing but just had never been a problem for him in his life up until now, they'll find that out right away. Or some sort of blockage, for example, one of the blood vessels that leads to the heart. If it is something else, if it is a high level of certain substance, either a prescription or other sort of substance in his bloodstream or his urine, that could take a little bit longer. And as we've talked about before, Anderson, with this story and the stories before, sometimes you never have an absolute answer as to exactly what happened. So autopsy done tomorrow, but lots of other tests that'll probably take days, if not weeks, for it to come back.
There is a statement that Brian Oxman, the family spokesman, made earlier to CNN. I want to play that for our viewers. It's a phone interview he did. It raised a lot of eyebrows and certainly raises a lot of questions and concerns. Let's listen to that.
This is not something which has been unexpected any time there was a report. Because of the medications which Michael was under, this family has been trying for months and months and months to take care of Michael Jackson. The people who have surrounded him have been enabling him. If you think that the case of Anna Nicole Smith was an abuse, it is nothing in comparison to what we have seen taking place in Michael Jackson's life.
Now, again, we don't know if what he is saying is accurate or not. It certainly seems to be his firmly held opinion. What would the autopsy show in terms of any prescription drugs he may have been taking?
Well, you can find a lot of different levels of different drugs through simple toxicology tests. At the time of an autopsy, you take blood, you take urine, you take various bodily fluids, and you save those and you examine those for all sorts of different substances. What is going to be harder to piece together, though, is how much was in his body at the time of his actual death, and was it acting either in isolation or in concert with other medications? And these become very tricky sort of situations to piece together. You can get some definitive answers and find out if someone had a high level of certain substances, but what it all means in the end is a harder question to answer.
It was cardiac arrest. Jermaine Jackson said earlier in a statement a short time ago that his doctor was actually present. If a doctor is on scene, can't a heart just be revived?
Yeah, there's a bit of confusion here, and I know that a doctor supposedly visited him last night as well. Was he not feeling well? Was he having some early symptoms of some sort of cardiac problem, fatigue, chest pain, or something else? Who knows? I have not heard the answers to those questions, but you're absolutely right. You can revive someone from a sudden cardiac arrest if action is taken immediately.
Okay.
And one of the best actions to take is actually defibrillating the heart, which means applying a mild electric charge across the chest and shocking the heart back into a normal rhythm. Or just simply even doing cardiopulmonary resuscitation, but I don't know. Each minute that passes after that, you start to lose valuable time.